Pelvic pain can be a really broad term, and because of so many things that fit in the umbrella of pelvic pain, sometimes it can be really difficult to discern where things are coming from. So for example, pain at the penile tip, that's pelvic pain. The need to frequently empty your bladder because it feels irritating, that's pelvic pain. Pain with sitting that feels like it's maybe your tailbone or your sit bone or something like that, that's pelvic pain. Pain at the lower back that's really like behind your hip back here, your SI joint, that's pelvic pain. Pain with intercourse is pelvic pain. Pain with inserting tampons is pelvic pain. Constipation or pain with bowel movements. So all those things can fit in that umbrella, and as you can tell, those are wildly different symptoms, oftentimes with way different causes. So the evaluation is important to figure out what's going on with your muscles, your nerves, your back. Is anything coming from the back that is maybe resulting in those other kind of sensations that are a problem and don't feel good? Another thing about pelvic pain is there are a lot of different terms and diagnostic labels for different types of pelvic pain. So for example, some types of pelvic pain are literally just named after the area that hurts. So vulvodynia, pain at the vulva. Sometimes pelvic pain conditions are as general as pelvic floor spasm is what it's called. It's important to know that you can get diagnosed with 4 different terms that all kind of have overlapping symptoms, and it's all correct, but it doesn't always tell you what's the cause of your pain. So without having an assessment where we can actually touch the tissue that is causing your pain, see that we can provoke it and then also change it for the better, that really helps us develop a program to help you. What's not as great for treating pelvic pain oftentimes is a lot of medical tests. So in general, you want to rule out an infection if you think it's an infection, but if it's not an infection, you really want to get those muscles and nerve pathways looked at, because we can test labs all day and we can keep testing the urine for every time something hurts and then being frustrated as to why are my tests negative. But medical tests really don't do a great job of explaining pain, not unless there was a recent acute injury, like you got hurt yesterday and now something is physically different. So I would be skeptical of any program to fix your pelvic pain that just tells you a certain muscle to target by itself. It really needs to have to do with looking at your back, looking at your sciatic nerve, looking at your abdomen, your pelvic floor, and then where exactly is this pain being reproduced so that we can get an idea of what's going on.